Now we would like to close our evening with 3 special honorees, this year's Moonlight and Roses awardees. Gary Fletcher has been a distinguished friend of the Family Medicine Residency of Idaho for over 20 years. Gary has been on our board and has been at the center of many changes that have made the Family Medicine Residency of Idaho what it is today.
I'm very pleased, and St. Luke's is very pleased to have been in a position to be supportive and helpful of the residency for so many years. There have been a variety of ways we've worked with the residency to provide coverage for those that are most in need. You know, what a wonderful opportunity for physicians to be trained in a wonderful community being led by doctors that are committed to family medicine and all the things that family medicine doctors do.
Gary is visionary, and he has the ability, I believe, to craft decisions carefully and with a perspective that will benefit not just the community, but certainly the organization and all those people that are affected by that work.
Karl Watts is a graduate of the Family Medicine Residency of Idaho in 1991, and over those 23 subsequent years has distinguished himself in providing care to the underserved.
All that experience really helped me develop, I think, as a leader, as a person that can manage different programs, interact with individuals and organizations in terms of gathering support, and work within the community and the things that the community needs overall.
You know, Karl doesn't just complain about stuff, he actually gets stuff done. And not only does he get stuff done, he actually inspires people to get involved with him. And so he's created a whole organization, Genesis World Mission, that has brought together people to solve, you know, our own community's health problems with the Garden City Community Clinic. And he's gone to Kenya and other nations and taken people with him. And so I think that whole idea of inspiring healthcare communities everywhere is that Karl really just draws people into his vision and his heart, and then he releases them to do what he wants to do.
Clay Campbell graduated from the Family Medicine Residency of Idaho in 1994. Since that time, he has epitomized our mission of taking care of rural Idaho. He also has been very active in educating medical students.
I always kind of had this Norman Rockwell-ish view of what medicine was supposed to be about and what taking care of people was supposed to be about. And I kind of continued with that, never really got away from that. I went into medical school knowing I wanted to do family practice, and all 4 years and the last 2 years, of course, with the clinical, it just supported that that desire that I had to do that. FMRI's dedication to, you know, training for rural medicine and giving you the tools that you need. I mean, I think that's kind of the one thing that really hits the nail on the head.
To be honest with you, we weren't really looking for a family practice physician when he came down and did a rotation with us. I said to my existing physicians, do we really need one? And he says, it doesn't matter, he's the right guy. And 15 years later, he is still doing just that. He hires his own people, he runs his own clinic, he works incredibly long hours. I write his dad once in a while and tell him how proud he ought to be of the son that he raised.